So of all of the things that patients worry about before breast augmentation surgery, the thing that probably creates the most anxiety is picking the right size. Everyone is worried about picking something too small or something too big. Everyone wants just the perfect size. So how do we figure that out? Well, I've developed this process over 15 years of being in practice and have perfected it, and it works incredibly well. But I always explain to patients that it's a collaboration between you and the surgeon, because no one can figure out what's going to make you happy except yourself. So let me tell you some of the tips and hints that I think are incredibly important for you to pick the perfect size. So number one, you have to know what you want. Don't come into the consultation until you have really thought about what size you think you want to be. And you can try to figure it out through a variety of ways. Maybe you can bring in pictures, looking at pictures. You can think of cup sizes, maybe friends who you have who you like the way their breasts look. But you should come prepared to the consultation able to either describe what it is you want or be able to show what it is you want, okay? Number two, when you do show results that you want, remember that the way a woman looks in a dress or a bra could be very different than the way she looks without that. What do I mean? Sometimes women have smaller breasts, but with the right bra and the padding, it can make the breast look very full, it can make the breast look very high, it can make the breast look substantially different than it really is. So just keep that in mind. When you are describing the look you want, remember that what you ultimately will look like in clothing and bras can be different than what you will look like just nude. Another thing to remember is that there's no such thing as one perfect size. Okay? There are many, many different sizes that would all look equally beautiful on you. And there are so many implants. There's like 5,000 implants that to say like one implant is way better than the other implant it's hard to say that because there's so many implants that would be great. However, having said that, keep in mind that there's a range. There's maybe 3 or 4 implants that would all look equally beautiful on you. And the only difference is how much fullness you want or how not full you want it. The last thing, and this is the most important part, how do we pick a size? Here in my practice, well, what I do with patients and what's led to so much success is using 3D technology. Because at the end of the day, you can look at pictures, you can talk to friends, you can think about cup sizes, you can do all of that you want, but if you can't see what it looks like on you, how can you possibly know what size is going to make you happy? Well, there's technology that can do it. The problem is a lot of surgeons don't use it, but I think top surgeons who specialize in breast augmentation all agree this is the only way for a patient to pick the right size. So what is this technology? Well, it includes a 3D camera. The cameras take pictures of your chest. So that camera takes pictures of your chest, and then the pictures are uploaded to the software. The software then creates a 3D image, which allows me to show you your body and your chest before surgery in every angle. Then I tell the software what implant to put on you. So it gives me a list of it has all 5,000 implants in its database. So I can pick any implant. And then by simply clicking on the size and then telling the computer to show that, it will, right in front of you in real time, show you what that result will look like. We can compare the before and the after. And we can do this with any implant, any size, any shape, any implant at all. I can show it to you on your body before you have surgery. By using this system, I have been able to not only create beautiful results, but results that patients are so happy with. So many of my patients come back and tell me that the implant that they ended up selecting and having was the exact implant they wanted. And if you go through this type of system, you are going to be incredibly happy with the size that you choose.